You are in tune with the nation's stations, ABS TV Channel 10, the GIS, and ABS Radio 90.5 FM. Proudly serving you, reaching more and more people every day. Good evening and a warm welcome. You're in tune with House Calls. It's another Tuesday evening when we present medical information, medical advice that could literally be the difference between life and death. It could certainly be life-altering. This evening we turn our focus on birth defects. That's right, so birth defects. All you need to know about them. What are some of the common ones? What are the risk factors? How can those risk factors be mitigated? And all you need to know. We'll also be addressing some common misconceptions about birth defects, such as, for example, some women who believe that they're young in their 20s, so they're perfectly fine, high and dry when it comes to birth defects. Well, sorry to disappoint you, but that's a misconception. This is the tip of the iceberg. The doctor in the house this evening is Dr. Siobhan Bell-Jarvis, who we are immensely happy to have join us. She's a consultant pediatrician, head of the pediatrics department at the Celeste Bird Medical Center, and chairperson of the Antigua-Barbuda Maternal, Child, and Adolescent Health Committee. Dr. Siobhan Bell-Jarvis, the doctor in the house, to talk about birth defects. We're happy to have you join us, whatever the platform you're using to join us, and wherever you're joining us in the world, because we have a global audience. This is, of course, the Caribbean's, and quite soon from now, the world's most powerful health program anywhere on television and on radio. Good evening, Dr. Siobhan Bell-Jarvis. Thank you so much for joining us. Really appreciate it.
Good evening, Mr. Burford. Good evening to your listening and viewing audience. I am happy to be here, as usual. As
usual. And our audience is immensely happy to have you as well. So let's start off with birth defects. What are they? I mean, what do we classify as birth defects, and what don't we classify as birth defects?
But Garfield didn't acknowledge my socks. I
am
still rocking my socks, as you can see. And I want to say an immense thank you to Antigua and Barbuda for going all out with us in rocking our socks in recognition of World Down Syndrome Day. I have to thank the Cycling Federation, the hardworking staff of the Celeste Bird Medical Center Pediatric Ward, NICU, maternity, everybody. So excellent. Don't ignore the socks. I mean, went all out, you know?
My sincerest apologies. How on earth could I not have paid attention to how flamboyant you're looking this evening? Thank you so much, Doc, for continuing. Of course, yesterday was World Down Syndrome Day, but you're continuing to raise awareness.
Correct.
Because it's one of the areas that we'll be talking about this evening as well, Down syndrome, right? And the importance of the support for individuals who are affected by Down syndrome and so on. So we'll talk about all of that. In fact, let's backtrack a little bit before we even start talking about, of course, World Down Syndrome Day yesterday. Of course, every break that we take, every commercial break, will actually be showing you some of the individuals, leaders in the society, children in the society. I mean, employees in different entities who would have also been raising awareness about World Down Syndrome Day and would have played a part in that as well. So, of course, you will be seeing some of those pictures right throughout the program. Even before we talk about birth defects, a little bit about Dr. Siobhan Bell-Jarvis, just to introduce yourself to the audience, as a doctor in the house this evening. Why pediatrics? And, just a little bit about your background in the area and so on.
So for me, I am an advocate for change. I am a champion of creativity. I am passionate about the arts, and so how could I not love pediatrics? Pediatrics offers you the opportunity to make changes from very early, and believe it or not, healthy children can become healthy adults. And so I thought that pediatrics offered me that unique opportunity to make a change at the right time. I'm a Christian, I'm a mother of two, and the wife of Mr. Jermaine Jarvis. I always big him up. And, I enjoy what I do. I am an advocate for parents, and I love to give a voice to those who don't have one.
Excellent.
Or who may not be heard.
Excellent. Greatly done in a nutshell. Very succinctly done. Thanks. All right, so Doc, let's talk about now the issue of birth defects. What are they? What do we classify as birth defects?
Okay, so I want you to remember 3 C's this evening. Birth defects are common, birth defects are costly, and birth defects are critical. By definition, birth defects are really structural changes that are present at birth. And when we speak to changes, these are changes that can affect any part of the body. The brain, the eyes, the mouth, the kidneys. You know, any change that can affect structure, how something looks, and function, how something works. Birth defects can either be viewed on the outside, or they can actually be seen on the inside. Now, how we classify them is important. You have major birth defects, and by major we mean defects that are going to cause significant challenges in one's medical health and also social health. So they have a significant impact. They can negatively impact longevity, and so you can have premature death, or they can also lead to disabilities, okay? Whereas minor defects now are, as the word implies, minor. They may be aesthetically unpleasing, so it affects how you look. You may not like it, but it does not have any significant impact on how you live.
You would give me an example, for example, about, you know, the position of somebody's ear.
Yes,
for
example. I have some slides that we're going to go through, major versus minor. And then, you know, there are many other detailed ways of classifying defects. So we have technical terms like malformation, where, for example, if a mother has fibroids in her uterus and it presses down on a part of the body, right, then you can have that part being deformed. So that's what we call deformation. You can have what is called disruption. So I have my fingers, the baby's fingers are normally formed, but in the womb you have something that looks like a rubber band. So what we call amniotic bands. We don't know why that happens. It presses against the fingers throughout the pregnancy, and therefore you find that the baby loses fingers, almost like an amputation, but it happens naturally in the womb. So that is disruption. And then you have malformation, where something is present, but it does not get to fully form. And then you have dysplasia, where everything is confused. So that's a more technical way of classifying birth defects, but tonight I want to keep it simple. So we're going to look at major versus minor. And I want to give you some examples before we go into prevalence, if that's okay.
Indeed.
So when we think about major dysmorphisms, or by the way, the terms I'm going to use are interchangeable. You're going to hear birth defects, you're going to hear congenital abnormalities, you're going to hear congenital anomalies. All of them mean the same thing, but I'll try to just use birth defects.
Yes.
So let's go to the slide that shows us some of the major birth defects. And again, viewer discretion is advised, because some of the pictures may be disturbing for some persons.
Indeed.
So when we speak about major defects that affect the external, what you're able to see, microcephaly. Micro means small. Cephalic speaks to head. So a baby who is born with a small head. Okay, and we're going to see some pictures coming up shortly.
Before you continue, there was a concern about microcephaly in relation to Zika
virus.
Indeed.
Very much so. And as it stands in Antigua and Barbuda, we would have had 4 babies who were positive for the Zika virus, but they have been doing fine. Okay?
Did they have microcephaly?
1 had microcephaly. 1 of 4 had microcephaly.
Interesting.
Okay, also had seizures and some challenges with development, but outside of that, the babies are doing well.
Indeed. Okay.
So you have microcephaly. As you see here on the picture, you have the baby who is to my right. You are seeing that the baby's head is of normal size, okay? The dotted line that you see going around that baby's head is showing the normal size that it should be, but you're seeing that the baby's head is much smaller than it really should be. Now, the size of the head also reflects brain growth. Brain size. Brain size is also reflective of brain function.
Indeed.
And so you can imagine that a baby who has a small head likely has a small brain, may function normally, but may also have challenges. Okay, good. And then we go on to what we call neural tube defects. So this is very important, and I speak to the images here. Now, by the time a lady knows that she's pregnant, the neurological system, the brain and the spinal cord, has already been formed. So we're looking at anywhere from 4 weeks, even going up to 6 to 8 weeks. You have a nice little groove. Think of a cut open straw. That's called the neural tube. And then it folds over on itself and it closes. If you go back to the picture, if anything causes you not to fully have that formation, then you're going to have what is called a neural tube defect. So you're seeing a little baby at the top with something protruding at the lower back. That actually has fluid that surrounds the brain and spinal cord coming there. It's like a sac. And it also has what we call the parts of the spinal cord coming into it. Wow. Now, when that happens, that baby is going to have significant challenges in terms of growth. Because the legs, there will be paralysis. There's going to be a challenge in terms of passing urine and a challenge in terms of passing stool, okay? The other pictures that were shown, you can see a sac-like protrusion coming from the back of the baby's neck, right? So again, all of these are part of the neural tube defects. It just affects different levels, yes. All right? And this can be linked to not getting enough folic acid in pregnancy.
We're going to speak about
that. We're going to speak about that a lot because most pregnancies, I should say, are not planned, eh? So by the time you recognize that you're pregnant, the nervous system has already been formed. So if there's an insult or an abnormality that's going to happen, by the time you recognize you're pregnant, it has already happened, which means that we have to plan pregnancies and we have to be taking our folic acid, but we'll get there.
Absolutely.
And then as we go down in terms of our major defects, we're also looking at things like cleft lip, cleft palate. Now, when we think of cleft, I'm sure you might have seen at Burford where you may have a baby who has a slit in the lip, as shown here, or a slit in the hard palate, the upper palate of the mouth.
Yes.
So you see a baby with a cleft lip before surgery and after surgery. So you see the importance there of having appropriate intervention, right? So you can have a cleft lip without the palate being affected, but then you can also have a cleft lip and cleft palate. You can imagine that this is going to affect your ability to feed, your ability to speak, right? And so this is something that has to be addressed from very early.
Yes.
Then we go to something that we see very commonly right here in Antigua and Barbuda, hypospadias. That just speaks to where the urethra, that is the tube that leads from the bladder out to the tip of the penis where it opens. For the normal circumstance, it opens in the center of the penis. But we do have circumstances where it opens at the bottom of the penis. As you can see the different openings there, just at the tip of the foreskin, the middle of the penis, and basically just above the scrotum. So can you imagine the challenges in terms of passing urine, as well as even ejaculation? Because where is the sperm going to go, Garfield, if you're having that opening at the tip of the scrotum?
It's going to go
we seeing
wherever
the picture?
the opening is.
But that is it. So it is a significant challenge. So when we as pediatricians, as healthcare providers, as nurses, as we examine the babies, we have to make sure that we examine well from head to toe. Because remember that we said that birth defects can affect anywhere in the body. Now, clubfoot. I'm giving you examples, breaking it down before we speak about how common things are internationally and locally.
Absolutely.
So clubfoot, basically, as you're seeing there, the foot is turned inwards, bent downwards, and you can imagine that with clubfoot, it can be very difficult for you to walk and do your regular activities. Again, something that we commonly see, and some babies or children need braces, meaning casting, to get the foot realigned, correct. Okay, and then congenital heart disease. So heart disease that you're born with, we're not going to spend a lot of time on that because Dr. Georgette Mead would have covered that in Heart Health Month already. Blind-ended tube, the esophageal atresia. So the swallowing tube that should lead from the mouth to the stomach, it is basically blind-ended. So you can imagine if you're going to feed the baby, where's the food going to go, Garfield?
It's not going to go where it's supposed to go?
Exactly. So then you have to have a surgery then to provide a formal passage for food to pass. And then you can have things like horseshoe kidneys, where the kidney is basically joined together and looks like a horseshoe. So these are some major defects, major abnormalities, major anomalies, okay? And then we go to the minor ones. So just for reference, in terms of the major abnormalities, 2 to 3% of babies who are born will have a major abnormality.
2 to 3%.
2 to 3%. The minor abnormalities are clearly more common. Up to 15% of babies will have those. And so I have some things to show. And I'm sure our viewing audience may say, hey, I have some of these.
Indeed.
So absent nails. And you can probably show the pictures so that we can go through them one time. So absent nails.
We're going to come to that picture shortly.
Ear pit or ear tag. Okay, I think I might have shown, you might have passed the one on the ear pit or ear tag, where you have just a small little hole. Some people call it hardened hole. I don't know if you know that, Garfield, because right, see it there? See it right there.
Yes.
So you have the ear pit at the front there. People call it hardened hole. That is a minor defect. The second picture is showing you an extra nipple. An extra nipple. So males, females, check yourselves. You may have an extra nipple, but again, it's a minor defect. It's not aesthetically pleasing, you may not like to see it, but it doesn't cause any significant delay. So you have an extra nipple here in a male, you have an extra nipple in a female. You can go to the next slide. Polydactyly, or extra fingers. I'm sure you've met persons who have had extra digits.
Absolutely.
You know,
absolutely.
on either
Some
side.
Some of them is growing on the side of the
Going on the side,
fingers,
having a long
hands.
fingernail and all of that. Even on the toes. You can have extra toes. So that's an extra digit, or what we call polydactyly. Poly meaning many, dactyl meaning fingers.
Yes, yes.
Or digits. Ankyloglossia, tie tongue. You see the little thing there at the base of the tongue that people call tie tongue. Again, a minor defect. And then the last one I will show is an umbilical hernia. Very common, Garfield. Many persons, basically, the muscles of the tummy don't close in as nicely. And so when you cough, when you lift heavy things, then you see a protrusion out of that area. A hernia is also one of the birth defects, but are minor because, again, it does not pose a significant health challenge.
Indeed. We've covered so much already. Can you
We've
imagine?
covered a lot. And we still have chromosomal because the chromosomes are the special packages that hold our genetic material. And so your genes are responsible for the color of your eyes, the color of your hair, what makes Garfield Burford look like Garfield Burford, and his, and your family, what makes you look like your dad or mom. So the chromosomes, they look like socks. They have the genetic material in them. And so sometimes you can either have extra material, which is what happens in Down syndrome, where you have basically you have 23 pairs of chromosomes, 23 from mommy, 23 from daddy. In Down syndrome, you have a third copy of number 21. So instead of having 46 chromosomes, you have 47. But that extra chromosome, even though it makes you extra, extra, extra special, it also causes delays in terms of your mental capacity as well as in terms of your physical capacity, and they have several health challenges. So those are the major classifications of birth defects, major, affecting your life, livelihood, social implications, minor defects, which basically are present. You don't like to see them, but they don't cause you any significant harm. And of the major, you have those that can actually take life and those that result in disability.
All right, so birth defects, and this is an extraordinary introduction to the topic from Dr. Siobhan Bell-Jarvis. As I said, I mean, you might know somebody who has one of these minor birth defects. You yourself might have one of these minor birth defects, like, for example, a sixth finger, a sixth digit, or toe. But of course, as Doc says, it doesn't necessarily impact on your day-to-day life. I mean, you get used to it and you move on. But there are the major ones which impact on people's lives and so on. We're going to talk about more of those, plus the risk factors. What women need to know, not just women, but men as well, men and women, when they're having children, as Dr. Siobhan Bell-Jarvis says, pregnancies must be planned so that those risk factors can be mitigated. We're going to talk about all of that coming up on this edition of House Calls. You're in tune with the program is sponsored by Sagicor. Our partners, in addition to Sagicor, are Pink Mongoose, responsible for our resplendent floral arrangements every Tuesday, and of course A.G. Morgan, responsible for us trying to look as certainly elegant as we possibly can. This, even though we don't have the socks like Dr. Siobhan Bell-Jarvis does. But of course, look there at Pink Mongoose and what they've been able to do every week, making sure that our set is absolutely resplendently adorned. When we come out, much more, and of course, each commercial break will be showing you some more of the pictures from yesterday and today as well, as thousands of individuals showed their support on World Down Syndrome Day, raising awareness about the issue by wearing multicolored, sometimes mismatched socks. Stay with us.
Life moves fast. Be prepared with Sagicor. Learn more at sagicor.com.
Seeing is experiential. Seeing is everyday life. Seeing is style, class, and sheer sophistication. At iMobile Vision Care, we offer state-of-the-art lab technology and the widest variety of quality eyewear from the biggest brands to suit your lifestyle. Stop by our offices at Dr. Rosalie Drive, Lower Gambles to get a comprehensive digital eye exam, or call us at 562-7823 and ask about our optical care services. iMobile Vision Care. See and be seen.
Thank you so much for staying with us right here on House Calls on all ABS platforms. We really appreciate your company. Thank you so much for joining us. And of course, your questions and your comments a bit later on in the program as well. It's an interactive program. So after we give pretty much a kind of tutorial from the doctor in the house, we have your opportunity. We give you the opportunity to ask questions and to make comments a bit later on in the program. So if you're just joining us, we're discussing the issue of birth defects. What are they? How prevalent are they? What are the risk factors? And what everybody needs to know about them. The doctor in the house is the esteemed Dr. Siobhan Bell-Jarvis, who is a consultant pediatrician, head of the pediatrics department of the Celeste Bird Medical Center, and chairperson of the Antigua Barbuda Maternal, Child, and Adolescent Health Committee. She certainly gave us quite a bit information there, all packed in a very, very succinct package early in terms of looking at the dichotomy between the major and the minor birth defects. And Dr. Siobhan Bell-Jarvis now has a powerful point to make about birth defects. Thanks, Doc. Over to you in terms of what everybody needs to know about it.
So you recognize the first C is going to become very available, very, easily understood at this point in time. Birth defects are common, which means that I may have a minor defect. You may have a major defect. Because I have a minor defect, it does not give me the right to somehow look down on you as having a major defect. So we're all in this together, and I need to also make the point of common variance. And so I may have a broader forehead than you. It may make me, me. You may have a broader nose than me. It makes you, you. At the end of the day, we're all unique, and we bring something different to the table. So difference should therefore be accepted, appreciated, and acknowledged.
And celebrated.
And celebrated.
Not stigmatized.
Correct.
Not looked down on.
Correct.
So we're going to come to that as well. That's a crucial point, a powerful point throughout our discussion about the importance of never trying to engage in any sort of bigotry because somebody else looks a little different or has a particular defect. We all have some sort of defect. Because it does appear that essentially you touch on the chromosomes earlier, and for example, with Down syndrome. Essentially, what happens with reproduction is that we're replicating our own DNA in another human. And sometimes in copying, it's like when you're photocopying something, something goes wrong.
Errors happen. Errors happen that
yes.
You sometimes do not have any control over. We're going to speak about risk factors later on and see what we can do to mitigate the risk, but there are other things that we really can't do about it.
Indeed.
Okay, and so we're going to get to that. But how common are these defects, Garfield?
Indeed. There we go.
The startling statistic for the United States of America, that every 4.5 minutes, minutes, Garfield, every 4.5 minutes, a baby with a birth defect is born. This translates to approximately 120,000 babies, and basically one baby having a birth defect out of 33. So if I had 33 babies in front of me, at least one of them would have a birth defect or something that is concerning, whether major or minor. The challenge that we have in Antigua and Barbuda is that we do not have a formal birth defect registry. And that's an important point to make, because you have to make sure that when we're classifying as major or minor, we're all calling major the same thing, we're all calling minor the same thing, and we're counting not only those that are born at the Celeste Bird Medical Center, those that are born at a private facility, and even those who may be born overseas and who come into the country. Absolutely. We have to count everybody. So we don't have a formal birth registry, but I want you to project for me some numbers. I have a table that shows the numbers in the US, yes, and the numbers here for certain birth defects. If you could pull up that slide for me, please.
Very shortly, yes, there we go.
So next slide. So when we look at something, remember we spoke about spina bifida. That is basically the neural tube defect, where the straw does not close over on itself and you have the spinal cord basically protruding out of the spinal column, which, yes, is not complete. Right. So in the US, you have basically 1 in 2,700 births. Very importantly, in 2020, we had a baby who had spina bifida. So for us, for that year, it would have translated to 1 in 1,000 births, okay? Let's look at congenital heart disease that was previously discussed. So go on to cleft lip without cleft palate. In the US, 1 in 1,500 births. Here in Antigua and Barbuda in 2019, we had 2 babies with cleft lip without palate, so that's 2 in just over 1,000. Yeah. And in 2021, we had another 2. So this is something that we need to watch, right? So the cleft lip without cleft palate. Esophageal atresia, we spoke about the swallowing tube being blind-ended like a pouch. But internationally, 1 in 4,144 births. We had 1 case in 2019, and that year we had just over 1,000 births. Okay. Diaphragmatic hernia. The diaphragm is basically that which separates the chest from the tummy. As you remember, we spoke about the umbilical hernia, the navel hernia, where things protrude. The diaphragmatic hernia is where you have basically an opening in the diaphragm, and the contents of the stomach go up into the chest. We actually had one case in the past 5 years. Wow. So it's really not as common. So for us, it's 1 in 5,400 births. Trisomy 18 or Down syndrome. Sorry, trisomy 18, which is separate from Down syndrome. Trisomy means that you have 3 copies of chromosome number 18. Okay. Okay, so you have a small head, you are very small in weight, you have a very prominent foot, you are delayed developmentally, you can have heart issues and seizures as well. We have to watch this as well. In 2021, we had 2 cases. 1 confirmed and 1 presumed.
Yes. So trisomy 18, different from trisomy 21.
So you have 3 copies of number 18, and it has different physical features. Whereas internationally, you have 1 in just about 3,000 births. Now, it's important to know that we said confirmed versus presumed. Garfield, I want you to sit at the edge of your seat. All right. In order for us to confirm or do the genetic testing on the baby, it is actually $1,800 and roughly $25 just for confirmation.
Of any of these ones? Or
yes, to do the trisomy panel, to do the genetic testing, $1,825. That is equivalent to the salary of some or even more than the salary of others. So it's not a test that we can look at the features and say, yes, this is a likely trisomy 18. But we cannot ask everybody. We can offer it to you, but everyone can't afford to do it.
Is there a subsidy for it? Is it
At this
covered
point,
under
no.
medical
This
benefits?
point, no. So that is where we need to get to, where we're able to offer funding to those who can't afford it. And we're going to get to that in next steps.
Thankfully, it is not as
common.
Right. So
not as common.
So that's a good thing. That's a consolation. But no consolation for a family who has, for example, a baby born with that.
Correct. And I just want to go back to that slide. It should read 5 cases from 2012. 5 cases from 2012 and not 2021. So from 2012 to 2021, we have had 5 cases of trisomy 18, 2 of which were in 2021, and basically we had the others prior to that.
Okay, so,
So 5 cases from 2012
there you go.
to
All right,
present.
there you go. Yes.
And
Okay.
clubfoot, which we spoke about, is very difficult to define in our parts because we don't actually count it. We see those babies on the well, the postnatal ward, the babies are well, so we don't actually count it. The point I'm making here is, 1, we do see the major defects in Antigua and Barbuda. 2, we need to have a formal registry, which we should have by the end of the year through the help of the Pan American Health Organization. 3, we recognize the significant support, emotionally, financially, physical, that is going to be required for parents of children who have these major defects. And I want to just show, I have a slide there, anencephaly. Anencephaly, that's basically a baby who is born with absence of the skull and absence of the brain. We have had 1 case of anencephaly in the past 6 years.
We're going to show that in a very short while.
So you can show that slide as well.
And by the way, just to reiterate the caution that Dr. Siobhan Bell-Jarvis indicated earlier, that some of the pictures might be difficult for some members of our audience to look at. So we do encourage and we do invite parental supervision, parental discretion to just make sure that you know, for example, if you're watching with a child, it's a family program, you're watching with a child, let's explain to the child that it's an educational program to just ensure that everybody can be brought up to speed with this. We'll just show you that in a very short while, just to make sure that you can get it.
So yes, so remember the 3 C's. I don't want us to forget them because, again, this topic is very technical, but I'm trying to make it as easy to understand as possible. So
you've been doing very well.
The first C was that it is common.
Right.
The second C is costly, but we're going to get to that. But let's go to the fact that it is critical. So when you look at it being critical, birth defects cause lifelong changes. Birth defects can result in deaths, whether it be miscarriages. So as a woman, I may find that I have multiple losses.
Yes.
Why am I having multiple losses? Is it possible that there are abnormalities? Secondly, I may have stillbirths. A baby who is a stillbirth is one who is born without signs of life. Up to 15% of stillbirths will have a major defect, okay? Which then results in them dying. And then when you look at deaths in the first year of life, 1 in every 5 deaths in the United States of America in the first year of life is because of a birth defect. Now, what has it been like worldwide? Within the first 28 days, 240,000 babies die because of a birth defect.
Every year.
Every year. 170,000 die from 1 month to 5 years. What is happening locally? 2019, 22% of our deaths in the neonatal period, the first 28 days of life, were because of birth defects. In 2020, 14% of our babies in the first 28 days of life died because of a birth defect. In 2021, 46% of our babies died in the first month of life because of a birth defect. This is a significant statistic. It says to me, and it should say to you, that there's something that we need to do about it. We need to appropriately track it, you know, and we need to appropriately prevent it. So again, 2019, 22% of our deaths in the neonatal period. 2020, 14% of our deaths. 2021, 46% of our deaths. So on average for the past 3 years, 27% of our neonatal deaths are because of birth defects. Now you can imagine, Garfield, if you were having care during pregnancy or might not have had care during pregnancy, your belly is getting nice and big and round, you have your baby shower, baby's kicking nicely, and then baby's born, and we come to you and say, you know, Mom, Dad, we are noticing these features that are concerning. Your response is going to be one of shock, devastation, you know, fear, disappointment, anger, guilt. Sometimes parents are saying, no, that can't be because my belly was normal, I felt kicks as normal, and the ultrasounds were normal. Even though we should be able to pick up some of the birth defects during pregnancy, not all will be picked up. And in Antigua and Barbuda, many of our birth defects are picked up at the time of birth. Very important point.
Which
means,
yes.
I mean, you have to be so cautious, which is why we're going to stress the importance of antenatal care. Not because I've had 5 normal pregnancies or pregnancies with normal outcomes means that my 6th pregnancy is going to be the same. Each pregnancy is different. And so that increase in statistic from percentages in the 14 to 22% to 46% is alarming.
It's frightening.
We have to do something about this.
Coming back to that statistic you mentioned, and we're just giving our audience an opportunity, for those who are joining us on television and online, an opportunity to digest and to ruminate on those figures. Just coming back to what you said, that's crucially important, that some of these birth defects are picked up at birth, not before, not during the pregnancy. Is that some sort of deficiency in the availability of the testing, the screening here in the country, or is that just a normal thing? Wherever you go in the world, whether you're in advanced economies, wherever, this is the situation generally?
It is multifactorial. You will find that there's some defects that you will not pick up antenatally or during pregnancy, but you should be able to pick up the major defects during pregnancy. The question you need to ask yourself is this. 1, are we having women who are having adequate antenatal care? 2, are they able to access the testing that is required, and we're going to touch that, in order to pick up these birth defects, okay? And 3, do we have at all points of care the additional expertise that may be required? So again, it's very common. Birth defects are especially common in your low and middle income countries for multiple reasons, as we go into the risk factors next.
Yes.
But it's very important. 1, you are encouraged, women. We are encouraged. Well, I'm finished with having babies, I think, unless
Yes.
the Lord blesses me again. But we have to have at least 8 visits during pregnancy, as per the World Health Organization, at least 8.
Wow.
Up to 30 to 40% of all women in Antigua and Barbuda are not having adequate antenatal care. I've been pregnant before. I don't need to go to the doctor. I'm experienced, I don't have the time. I have to work. I don't want to go into my community clinic because persons are going to know my business. Those are some of the reasons. I can't afford to go to the private doctor, but the clinic is free. Okay?
So there's no excuse.
So there's no excuse. So women, myself included, if I'm blessed again, Garfield,
Yes,
8 visits in pregnancy, 8. And again, you need to start as soon as possible, within the first 4 months at least. Gone are the days where you're showing up at the doctor in your 8th month. I'm pregnant and I just want to make sure everything is okay. Gone are those
Too
days.
late.
Too late.
Far too late, yes.
For you to basically control, but we're going to go through risk factors at this point.
Sage advice from Dr. Siobhan Beljarvis, keeping it real, just making sure that you understand at least 8 antenatal visits, ANTE, before a birth. It's important because it could be the difference between a life-altering, a life-changing, a kind of, epoch-making kind of situation where you have a child with a birth defect or not. Yes,
And we need to underscore, double underline, highlight in an uncomplicated pregnancy, which means that if you have high blood pressure, diabetes, lupus, kidney failure, any other condition during pregnancy, you have to go more than 8 times.
Wow.
So the minimum of 8 is in an uncomplicated pregnancy. If you have any, what we call comorbidities or other medical conditions, you have to go more than 8 times. And the district clinic is free of cost. I'm putting that plug there.
Extraordinary. So there's no excuse. It's not cost prohibitive. We're going to take another break. When we come back, we're going to touch on, Doc, the issue of the risk factors. So what are the risk factors that essentially predispose some individuals, some women, to having children with birth defects? We're going to come to that in a short while. Of course, this is a topic, I don't want our men to go watching sports because I'm thinking that somehow this is a topic for women only. This is a topic for our entire human civilization. We have been preserved as a species. We have survived as a species through reproduction, through the fact that we actually continue the species. All species do it. And so it's important for everybody who is watching, whatever your age or stage or gender, So don't think that somehow it is, you know those ads on cable where you're saying if you're pregnant or planning to become pregnant? No, it's not only for those women, it's for everybody. It's all for the entire family. When we come back, risk factors. You're in tune with House Calls. The program is sponsored by Sagicor with the kind compliments of Pink Mongoose and A.G. Morgan. Back after this.
I had a really good time tonight.
So did I.
Life moves fast. Be prepared with Sagicor. Learn more at sagicor.com.
This week on Conversations, we speak to Nicholas Fuller.
A lot of these people wouldn't even know his name. I'm going to tell you a story about Sir Luther Winter.
Join me, Natalie Clark White, for Antigua and Barbuda's prominent people stories and be inspired.
Thank you so much for staying with us. The program is House Calls on all ABS platforms. It's our Tuesday evening program devoted to bringing you the very best medical advice. And each week, we are pleased and privileged to have a doctor in the house to share extraordinary information, to share their expertise with us, to be really on call with our audience. I mean, this is the kind of thing that you actually go in and actually pay for a consultation with the doctor. We're providing it free of cost to our expansive audience. Really appreciate it. So our doctor in the house, Dr. Siobhan Bell-Jarvis, consultant pediatrician, head of the pediatrics department at Celeste Bird Medical Center and chair of the Antigua-Barbuda Maternal Child and Adolescent Health Committee. She joins us to talk about birth defects. Doc, the issue of risk factors now is crucial because women who are pregnant or planning to become pregnant should be very mindful of this. Not only women, but their male partners should also bear those things in mind. What are these risk factors?
Yes, so let's go through alcohol. If you are pregnant or planning to be pregnant, you should not drink alcohol.
Zero?
Zero. You see I have it here? An alcohol-free pregnancy is the best choice for your baby. Drinking can result in miscarriage, stillbirth, prematurity, what we call fetal alcohol syndrome, sudden infant death syndrome. So zero for any pregnant woman. The thing is, we do not know what level of alcohol consumption negatively affects the fetus.
So err on the side of caution and go none.
None.
So not even a little red wine?
Zilch.
Zero. Okay,
Zero.
good. Just want to make sure that you
Zero.
understand that.
Okay,
Yes.
so an alcohol-free pregnancy, best choice.
Excellent.
Next risk factor, smoking. We are not only speaking about tobacco here, but we're also speaking about marijuana. This is very topical and this is very common. So we see a lot of women who, smoke throughout pregnancy. What we have been noticing anecdotally, and by anecdotally we mean by observation, what we see on a daily basis, is that many of the babies who are born to mothers who smoke marijuana are born small. Okay? So again, stay away from smoking, as the young people do, period. Okay? Medication.
Zero.
Medication. So medications for seizures. So if you're looking at things like valproic acid, carbamazepine, medication for your acne. If you're on any medication at all, if you're planning pregnancy, again, consult with your physician because we need to see, is this compatible for use in pregnancy? Recreational drugs, self-explanatory. Infections. Now we have a special, what we call mnemonic, or letters that we use to represent significant infections that can negatively affect both mommy and baby. The word torch, I'm not sure if you've heard it. T for toxoplasmosis. That is basically transmitted through eating undercooked meat, being exposed to young cats, and even their stool. Rubella, okay? Which is why you really should be vaccinated and covered in terms of rubella, right? C, cytomegalovirus. For people who take care of young children, CMV, that's how you can get it, right? H for your HIV, your herpes, and then the O would have represented other. Things like Zika, which would have resulted in the heads being small, them having, you know, what we call contractions or stiff limbs and even seizures.
Yes.
Let us look at the age. Now, women, I know that we want to be, you know, advancing, getting our PhDs and so on. But we have to take a break at some point, because once you're over the age of 35, you're considered to be of advanced maternal age. That is the appropriate terminology, right? You are of advanced maternal age, which means that there's an increased risk of error. Now, the men think that they're like the Energizer Bunny. They can keep going and going, 80, 70, you know, and still be having children. Now, that is very debatable in the science world. So even though an older man, and by older in the male, we're looking at the age of 40 in some literature, others refer to the age of 50 as being a man of advanced age. But it's debatable because the World Health Organization would have said that in 2019, thereabout, or 2016, that even though a man may contribute to errors because of his age, it is not thought to have as significant an impact as the mother's age. Now, why is that so? It's very hard to say, but remember that basically our eggs are with us from birth, and they are with us and we gradually lose until we die. The men generate fresh sperm. So that is something that we can think about there. So men, even though you may be able to keep going and going, cool it down after the age of 40 or 50, because again, it's not just about whether or not you contribute to an abnormality, but if an abnormality occurs, can you financially support, physically support, emotionally support? Indeed. Obesity, significant impact in terms of abnormalities. Diabetes, high glucose levels are very toxic to dividing cells, and so high blood sugar or diabetes can result in birth defects. Environment, heavy metal, lead, etc. can contribute, and socioeconomic status. Again, this is thought to be related to being able to have nutritional meals, being able to consistently have the appropriate health care, etc. And genetics, which you really can't do anything about. So that is the non-modifiable, but all of the others that you see there are modifiable. You can't do anything about your genes. You are who you are based on your family line.
Indeed. So no smoking,
so
no drinking.
Smoking, no alcohol. Review what medications you're taking with your doctor. No recreational drugs. Avoid traveling to places where there may be an outbreak of certain diseases. So when Zika was very prevalent, you have to be cautious with travel, avoid mosquito bites, wear appropriate clothing, etc.
Yes.
Watch your age. So if you may be someone who, you know, is very keen on having an advanced education, or you may be starting late, take a break and have your family, and then you can always go back. Obesity, diabetes, other chronic illnesses, the environment, and your socioeconomic status does have a significant impact. Unfortunately, you know, that really should not determine, you know, your outcomes, but it does.
It does. It's just the reality of the situation.
That's the reality.
In other words, it's not the world as we would want it to be, but the world as it is. In terms of recreational drugs, it's not only tobacco smoke, but marijuana smoke, you're saying?
Correct. And even in terms of this new thing of vaping, please, no vaping in pregnancy.
All right.
All right.
That's crucial. The issue now of age, so this is 35 years for women.
Yes.
Is that 35 years for their first, or let's say they had 3 up to 35, no more after 35?
Right, so basically, your risk of having an error in terms of pregnancy increases as you go over the age of 35. It does not mean, however, that persons under the age of 35 will not have a baby with a birth defect. It just means that the risk is on the lower side. And you have to be very cautious of the extremely young in age, so you're teenagers as well. Mm-hmm. So it's both extremes, but definitely if you're greater than 35 years as a female, it significantly increases your risk.
Mm. So, and of course, it does mean that a woman over the age of 35 is always going to have a child with a birth defect.
Not always.
It's not always. It increases the risk.
It increases your risk.
So, a woman who is 36 and who has already had 3 children should think, what would be your advice to that woman?
My advice would be,
who wants to have another?
At this point in time, hold your horses a little bit. I mean, yes, you want to have another baby, discuss it with your physician, and you have to bear in mind the fact that you're going to need to do testing. I have something there on testing, we can probably run to that right now.
Yes.
in terms of screening. So once you're going to your physician and you're of advanced maternal age, then you're going to go through screening tests, which include blood testing in what we call the first trimester. So by 10 to 13 weeks, you're going to be looking at a special ultrasound, you're going to be looking at blood testing. They can actually test the mother's blood to see if, you know, the baby's cells that are there, if they're abnormal or not, and to look even at the gender or not. Are you having a male or female? So there it is. So that's self-retesting, the cost, Garfield.
Do I have to sit on
The
edge of my
cost
chair
of it,
again?
edge of your chair again,
Okay, geez.
just over $2,000.
Oh my.
So these tests are not offered in mainstream, in your district clinics, for example. You know, it may be offered to you if you're seen in the hospital. It can be offered in the district clinic, you know. But again, it's not something that is offered necessarily routinely.
Yes, yes.
There is a cost attached. And then when you go over to your second trimester, you're looking at, again, what we call a quad screen, a special blood test to look for abnormalities, as well as an ultrasound. Now, this ultrasound between 18 to 22 weeks is very crucial because it's looking for abnormalities. You're looking at the brain, you're looking at the heart, is it on the appropriate side, does it have 4 chambers, you're looking at the stomach, you're looking at everything,
you have 2 kidneys?
Everything. Right. So this is what we call your anomaly scan, or your remember we said congenital anomalies, equivalent to birth defects. So does my little one on board have any abnormalities? Many women miss the scan. Many women miss the scan because remember, they're not attending clinic in that first segment. So they've missed the scan. Now women, we have to be prepared, and families, if we're testing, if the test comes back suggestive of having a baby who has a concern on board, the next step is going to be what we call diagnostic testing, confirming.
Yes.
So screening says, what is my likelihood or what is the possibility of me having a baby with this abnormality? Diagnostic testing, confirmation. So amniocentesis, very quickly, where you're going to take some of the amniotic fluid and test it. That is done here. Cordocentesis, where you're taking material from the cord. It's not done here. And they are associated risks. So it has to be done in a high-level center. Okay? But again, if you get that information, what is your plan? You know what I mean? Some families said, am I going to keep? You know, abortion at this point in time is not legal in Antigua and Barbuda. So again, you see the conundrum that we have here.
Yes, it is tough because these are the tough issues for people to contend with. And again, the importance of the antenatal visits and the screening that's available. So if you could go back to the slide again, to our control room, to Lennox, if we could just go back in terms of what is available here vis-a-vis what is not available here.
Correct. So that first trimester ultrasound, where we're basically looking for an extra fold at the back of the neck, what we call the nuchal fold thickness, that is available here. Your blood testing for special results in the blood to say, okay, am I at risk of having a baby with a concern? That is available. The self-retesting, which I said was $2,000 and something, that is available here. Right? And then when you go on to the quad screen, available here, and by available here, it means that we offer it here. Many of these tests go to overseas labs, which is why they're also so expensive for processing, and then we get back the results. And then that special scan between the 18 to 22 weeks, that scan is available here.
Okay, all right, there we go. So
okay, good.
The importance of prenatal or antenatal testing are crucial for the process as well. Doc, the issue now of, so after all these tests and so on, child is born with a birth defect.
Yes.
Let's say a major birth defect, right? Because as you mentioned earlier, we all have, most of us have some sort of defect. Some of it is minor, some of it a little bit more major.
A common variant.
There you go. So a child now has a major birth defect. What are the support systems available? And let's talk about the impact that it has on the family, the community, the nation, and then, of course, the issue of the support systems in place.
So let's start with impact, and then we can go to support.
Indeed.
So I look at impact on health, medical health. Birth defects account for significant hospitalizations and increased frequency of hospitalizations. Yes. We spoke to the fact that many of these babies may require surgery. Now, especially in terms of heart disease, we are unable to offer heart surgery here. We are in collaboration with World Pediatric Project. When they come and do their heart ultrasounds, they can say, okay, these few may need surgery, then they also refer them to the United States of America, or we can refer to other centers across the world to have the necessary heart surgery done. So significant impact in terms of admissions, need for medication, complications, the need for surgery, many of which are not offered here, the whole issue of the socio-emotional, again, mommy, daddy going through guilt, anxiety, fear, how am I going to manage this child, can I afford it, other siblings, this child is always getting attention, what's happening with us here, why does the child look this way, the whole issue of stigma, and again, please, one thing I want to say, never ask someone, what is wrong with your baby? If you're going to be having that approach...
It's a sensitive question to ask.
Then, you know the song Garfield, sip water and mind your business?
Yes,
you're going to sip water and mind your business because you're not going to ask that question, what is wrong with your baby? Education. Now, educational facilities, special education, we have the Victory Center here locally, we have the Adele School, we have chats, right? But again, these centers are gradually becoming filled. Okay, so we need the special education teachers, and I applaud the teachers of the institutions I just mentioned because they're doing an excellent job.
Extraordinary. Extraordinary.
The whole issue of employment. So again, many people think, okay, these children with birth defects, they may not amount to anything, so why, let's just have them as a babysitting club. So the special educational centers are seen as a babysitting club, but they're not, persons don't see the need to prepare them for the work world. I want to know here in Antigua and Barbuda, and it's really on my mind, how many workplaces have children with adults now with Down syndrome, adults who may have dyslexia, adults who have intellectual impairment, learning disabilities, actively employed.
Yes. Do you think that there's need for a kind of affirmative action kind of situation?
Yes.
Where you have, designated numbers of individuals who have developmental disorder and so on, who would then need to be employed?
Yes, but you see, it takes preparation. The staff have to be prepared.
Yes. You
have to look at, the roles that will be played by each individual, and again, removing the stigma from even the workplace. But everybody, there's something that each person brings to the table, and I think that's what is happening. We prepare them, then when they become 18, where do they go?
Absolutely.
What do they do? Community-based rehabilitation centers are deemed to be the way to go. Quickly, in the interest of time, the economy. In the US each year, I have it here, the total hospital costs is $2.6 billion every year, and it does not include outpatient services.
Just hospital care?
Just hospital care. Wow. Premature death, increased risk of abuse. Now remember, some children with birth defects are nonverbal. So if somebody physically, sexually abuses them, no one may know.
They can't talk about it.
Many of our children who have intellectual impairments or disabilities are very friendly. Patients with Down syndrome, they love to hug a lot, they're very bubbly, they're very trusting, again, at high risk of abuse. So we see the significant impact, health-wise, education-wise, employment-wise, economy-wise, in terms of premature death, so loss of productivity and loss of life. One loss of a life is one too many, and increased risk of abuse, right? So that is concerning. But in terms of what else we have available here, we have speech therapy.
Right.
Again, private entity, costly. We have occupational therapy. Again, relative private entity. We spoke about the special educational facilities. We have social services. We have World Pediatric Project, which is able to visit and look at our hearts. We also have neurology services, surgical services. We have a visiting pediatric surgeon. We have pediatric medicine. We have an eye specialist. We have physiotherapy. We have nutrition. You see how many support systems you need, but all of them need to be available in the governmental setting.
Yes.
Because not everybody can afford to do things privately. I have a quote there. Care is an absolute. Prevention is the ideal, Burford.
Yes.
But care is an absolute.
Absolutely.
And so we have to then see what needs to happen.
Now, before we go to our next break, and by the way, when we come back from this our next break, you can go ahead with your questions and your comments, 4622996, 4622996, when we come back from the next break. Just ahead of that break, though, the issue now of breaking down the stigma, the walls of stigma. Because, unfortunately, in our Caribbean folklore and our Caribbean sociocultural constructs, you hear about people have this very, ridiculous notion that somehow, a family with a child with a birth defect, it's a sin that the family committed. And you see, it fell on the poor child. And the family is there to blame because some evil that used to happen how many years ago, that has now befallen the child. We need to break down that. It's a real problem, isn't it?
Yes, misconception. And you also have families that are moving away from their relatives because they have a child who has special needs or who has a birth defect. Some persons are even embarrassed, unfortunately, of their family member because they are different. We have to remove that stigma, and that's one of the reasons why, we're so passionate as a department in terms of raising awareness. Again, that is only the beginning of the battle. You see how many things we have to overcome there, which leads very quickly to our next steps, or do you want to go to the break?
We're going to go to the next break, Doc, and when we come back from that break, we're going to be talking about the next steps, plus some common misconceptions.
Yes, and facilitate questions.
Yes, of course.
I'm ready to bat. Let's go.
There you go. I mean, the doc is ready for spin or pace, anything. So, by the way, the issue now of misconceptions, we touched on it at the top of the program. So, women who think that, look, they're in their 20s, early 20s, they're good to go. Zero risk of having a child with a birth defect. Let me give you an example. You're wrong if you're thinking that. We're going to talk about that plus some other common misconceptions when we come back from this final break here on House Calls, and then your questions and your comments 4622996. You can actually start calling during the break. Stay with us.
Life moves fast. Be prepared with Sagicor. Learn more at sagicor.com.
What are you doing every weekday morning between 6 and 9 a.m.? Why not join us for Antigua Barbuda Today, the best in news, views, and interviews. Here's what's coming up tomorrow, Wednesday. We sit with Dr. Leslie Walwyn as we explore the issue, how do we reduce childhood obesity across Antigua Barbuda? It's also World Meteorology Day. We sit with meteorologist Orvin Page. And Antiguan author Luella Jackson joins us. We delve into her latest contribution. It's called Veggie-Town. Those and so much more coming up tomorrow at 6 a.m. on Antigua Barbuda Today. It's all here.
Thank you so much for staying with us. Birth defects is the subject of our discussion. The doctor in the house is Dr. Siobhan Bell Jarvis, and we thank you so much for your company. You can actually go ahead and start calling now. We'll be able to take your calls while we're actually finishing up on our topic. 4622996 is that number to call. We'll also be able to take your comments, your questions on Facebook as well. We'll put them up at the bottom of the screen, and I might actually have those questions answered by Dr. Siobhan Bell Jarvis. Doc, the issue now of you have a few other issues to talk with us about, the misconceptions.
So we spoke about most of the misconceptions, I think, in terms of the fact that being young doesn't mean that you won't have a baby with a birth defect. The fact that males do contribute to the possibility of birth defects. So it's not just the mother's fault, but the impact of the male is not thought to be as significant in terms of advanced age. The fact that it's not due to some sin committed in the past and retribution now coming your way or punishment. You know, the fact that even though I have had pregnancies with a normal or acceptable outcome does not mean that my next pregnancy cannot negatively be affected because of a birth defect.
Okay.
Those are some of the main misconceptions.
Just before we go to the first caller, and actually have callers on the line already, you have another quick issue to talk
Sure,
about.
just very quickly. We have to make a pact in terms of prevention, and I have that side quickly. P is planning ahead. You're going to plan your pregnancy, and you're going to take your folic acid
Right.
at least a month before pregnancy, or even up to 3 months. Avoid harmful substances. We spoke about that. No cigarette smoking, no marijuana smoking, no alcohol smoking, no alcohol drinking, sorry. Choose a healthy lifestyle. So that's the C. So P, we're going to plan ahead. A, we're going to avoid harmful substances. Remember, we're making a pact.
Right.
C, we're going to choose a healthy lifestyle, eat healthily, be physically active, and get our chronic conditions under control. And then T, we're going to talk to a healthcare provider. Get our checkups, discuss medications, talk about your family history, and please remember that we have to have counseling before we plan to get pregnant. Preconceptional counseling. Okay?
PACT, P-A-C-T.
So we're planning.
Yes.
We're avoiding. We're choosing a healthy lifestyle, and we're talking to a healthcare provider. We're making a pact in terms of preventing birth defects.
Folic acid, you touched on it before.
Folic acid.
Why is it important?
It's important because we want to avoid the neural tube defects that we spoke about.
Folic acid prevents that.
Yes. It helps to contribute to preventing that whole issue of, you know, the spinal cord being the column being incomplete with the spinal cord being exposed.
The issue now, you're saying that women need to almost like take it routinely because sometimes when they realize they're pregnant, the horse is already bolted. So is it that, how often should women take this?
So, Garfield, you know what I mean? I need to give you an honorary degree in medicine because the discussion now is maybe women should consistently take folic acid on a daily basis because so many pregnancies are unplanned, and by the time we recognize that we're pregnant, the horse has gone through the gate, because remember we said that the crucial organs are being formed, you know, even by 4 weeks, going to 11 weeks they're already formed.
Before the woman knows she's pregnant.
Most times, you know, we're pregnant anywhere from about 8 weeks or so, that neural tube has already, you know, closed.
Doc, let's take the break and we'll come back to the
Sure.
issue of folic acid. Not a break, we're going to go to our telephone lines first. Good evening, caller. Thank you so much for joining us on House Calls. Go ahead, please.
Good evening.
Good evening, how are you?
I'm good, Dr. Bell.
Good evening.
Nice having you again.
Thank you.
Yes. In the neural tube defects, you spoke of alcohol and different things. But when women who take different kind of medication, can they have a defect too?
Yes, we spoke about the medications. We spoke about
alcohol and different things. But medication, some people taking a lot of pill, a lot of tablets, and the embryo at this early stage of pregnancy, will that affect the baby?
Yes.
Let them know that, yes. You know, we like to go over the counter and buy tablets and take tablets. Well, the folic acid in the neural, that prevents the spina bifida. It strengthens the bone.
All right, caller, what I'll ask you to do, when you ask a question, is give Dr. Bell Jarvis a chance to answer. I think when she's answering, you're still cutting in. So I'll ask you to ask a question, then give her an opportunity to answer. So which question do you want her to answer now?
Concerning spine, the folic acid. You know, when they go to the clinic, they give them this folic acid, early pregnancy. That helps in the formation of bone, it helps to prevent spina bifida.
So the folic acid is very important in preventing spina bifida, or an incomplete formation of the brain and spinal cord, and the covering of it, which is basically the spinal column or the vertebrae, okay? So taking folic acid is key, and what we're saying is that you need to start at least a month before planning to be pregnant, even 3 months before planning to be pregnant. But the discussion now is whether or not women should actually take it every day, since many pregnancies are unplanned. The first part of your question in terms of medication contributing to birth defects, the answer is yes. We spoke about the medications for seizures, we spoke about medications for acne, multiple medications for other illnesses, which is why, as a part of the T in PACT, you have to speak to your healthcare provider, review the medications that you're taking so that it can be adjusted to be appropriate for pregnancy.
All right. Thank you so much, caller. Really appreciate it. And let's go back to the telephone lines, though, Doc, for another call. Good evening. Thank you so much for joining us on House Calls. Go ahead, please.
Good evening.
Good evening. How are you?
I'm good.
Great.
Okay, let me, in terms of minor abnormalities, how many of the minor abnormalities can be corrected by surgery? And also, would you recommend surgery for certain types of abnormalities? I saw years ago where this doctor was able to lengthen the legs of a person who was born with dwarfism. What are your thoughts on cosmetic surgery for some people that are born with certain abnormalities, the parents wanting them to look normal? And if your answer is, you don't really recommend, how do you compare this to somebody who's born with a minor abnormality and the parents, like, I'm born with a sixth finger, I cut it off. And then you have a problem with somebody who wants to, lengthen their child because they're born with dwarf. I just need to know your thoughts on these. I'll listen off here. Thanks.
Thanks, caller. I really appreciate it. No?
So for the minor defects, as we said, they have no major impact on health or on an individual in terms of their social abilities. The minor defects for some people are, they're uncomfortable about it. We have parents of children who have extra digits and they're fine. Leave my child alone. That is their response. We have other parents who are, can you remove the finger please? And then we appropriately refer them because of course, it can have an impact in terms of even bullying, ability to appropriately move the hand and so on. So it does depend on the defect. An extra nipple, we're not going to do anything about that. The ear pit, we're not going to do anything about that. If your ear is a bit too low, we're not going to do anything about that. But those minor defects that may have an impact. So for example, a hernia, an umbilical hernia. Sometimes, if it is significant, the bowel itself can come out and get stuck. In that case, that is now an emergency surgery where we have to correct that problem. So it just depends on what the minor defect is, where it is located, what is the impact on the child, and what is the parental feeling about that defect.
All right. Caller, thank you. I'm pretty sure that you would have been satisfied because Doc was very comprehensive with that answer. Let's go back to the, in fact, okay, let's take Facebook and then we'll come back to the telephone lines. This is Trudy Williams asking, good night, Doc, and myself, I was born with 2 wombs. Is that a birth defect? I was born with 2 wombs.
Yes, it is a defect because remember we said that when we look at defects, it is a change in structure, physical structure, whether it be external, what we can see, or internal, what we can't see with the naked eye, as well as function. So you can have what we call a bicornuate uterus, where the uterus has 2 horns, so to speak, then that is a birth defect because it is a change in terms of the structure of the organ.
How is that corrected? Does she do surgery? What would happen?
Well, she will consult with her gynecologist and they will take it from there.
Okay, there we go. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on House Calls. Go ahead, please. Good evening. You're on House Calls, but I'll ask you to turn down your television. Yes, I'll ask you to turn down your television, please. Thanks. Yeah. Go ahead, please.
Yes. Good night, Dr. Bell. Excellent program, Mr. Burford.
Thanks.
I have a question. If 2 cousins, whether they're second or first cousins, and they get married and they're having children, is it a myth that that child or children will come out with defects, or is it a myth, or is it real that the relationship is too close?
Excellent question, and that is something that we should have discussed. I'm so happy the caller asked. It's what we call consanguinity. Fancy term, consanguinity. It just simply means that you have persons who are close relatives being in, a relationship, and we do recommend that this does not happen. because again, it can put the child at risk of various abnormalities, which can be concerning. There is actually a parish in Jamaica, Garfield, I'm not sure if you're aware, where many of the persons within that community are related and they actually have children together. They actually have a different color in terms of their eyes, right? So we do not encourage consanguinity, and whenever we have a birth defect, even seizures or anything concerning, we always ask, are you related? So in Antigua and Barbuda, before you get married, make sure you attend each other's family functions so that your mom may say, oh, but that's our cousin over there, you know, before you have your engagement party, because Antigua is very small. But consanguinity, that coming together of relatives, first degree cousins and so on, is to be discouraged.
Absolutely. What kind of defects is, I mean,
it's not specific.
Wide
range? Wide range
of birth defects. Yes. Caller, you go to the head of the class, please. That was a brilliant question you asked. Really appreciate it. All right, we have another caller right now. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on House Calls. Go ahead, please.
Good evening. Very, very informative program. I wish we had programs like this when I was having children. But Dr. Bell, I have a question for you. What is your take on giving a pregnant woman Ventolin in her first trimester? That woman would have been experiencing premature contractions and was given Ventolin in her first trimester. What's your take on that in regards to getting certain medications too early within that pregnancy? I will listen to your answer off air.
Okay, so when we look at the use of Ventolin, many persons are familiar with the Ventolin in terms of asthma. And the way that Ventolin works is that it helps in terms of muscle relaxation. So you can imagine if the tubes that go down into the lungs, if the muscle is constricted and it's tight, then the Ventolin helps to relax those muscles. Sometimes for persons who may have contractions prematurely, then Ventolin is something that can be offered to help to basically relax the muscles, okay? The point in time at which it is offered is a judgment call by the obstetrician. You know, usually when we try to stop premature contractions, it's either to, one, give us the opportunity to give steroids to help with the lung maturity of the baby, or to help us to give another medical intervention to optimize the outcome. So usually if we are trying to give something to stop the contractions for an alternate end, and that's fine. But if you're having contractions from very early up, if you're likely to miscarry, then you may not be given medication to stop it if it is too early. Okay. So again, the Ventolin is not something that is unfamiliar in terms of use for stopping the contractions, but again, that judgment call will be made by the obstetrician in terms of when it is given and to whom it is given based on the purpose.
I see. All right, there you go. Caller, thank you so much for asking that question. Austin Osborne, we'll come back to the telephone lines in a short while. Let's go to Facebook in the meantime. Austin Osborne asks, what if the male smokes and or drinks rum while his female partner does not? Does that make the risk of birth defects higher?
Okay, so we have to recognize the significance of secondhand smoking. So you should not be smoking around your partner. In terms of the risk of drinking from the male perspective and the incidence or the occurrence of birth defects, then that really has not been proven to be the case. And so smoking, I would say to avoid. Drinking would not have a direct impact, as far as I'm aware, from the male.
From the male perspective.
But for the female perspective, alcohol-free pregnancy.
All right, zero. No wine,
Zero, zilch,
no wine, no red wine. All right, there you go. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on House Calls. Go ahead, please.
Into your wonderful program.
Thanks. Appreciate it.
Okay, Doc, I have a question. My daughter was born with two of the defects that you spoke of, the minor one. She was born with an extra finger. It had nails, of course, yes. But I asked them to tie it off, so you know it drew both of them. I also was born with the extra fingers, as they would say, and also with the navel. She actually was born with the navel, being a little bit bloated when she cries. The I don't know if it's air or whatever that would enable it to grow real big. So I'm asking, would that not just disappear? Or is it, as you said, it might be a hernia?
So much for the question. So in terms of the umbilical hernia, that protrusion from the tummy, usually we do nothing about it until the age of 5 years. Because by that time, if it's going to close, it will close by the age of 5 years. And then we have discussions with the parents. Okay, this is the size of the opening that remains. Do you want us to do anything about it? Okay, so 5 years, that's the age of cutoff. In terms of the polydactyly or the extra digit, it really is a decision that is made by the family if they want to be removed. One clarion call here though. Persons sometimes, like how you tie the dog's tail or put a rubber band on the dog's tail to have it to come off. I don't know if you used to do that as a child. Used to. Yeah.
Not quite.
So
but I used to see it, yes.
Yes, so you used to see it. What we have parents sometimes doing is taking a piece of thread, tying it around the extra digit in an attempt to cause it to drop off. You have to be cautious because when you have an extra digit, you can have an extra digit with or without bone. With or without bone. Now, if you're tying a piece of thread around it, you have the risk of it becoming infected. So we're asking you, please, if you do want it to be surgically removed, let us refer you to the appropriate personnel. Plastic surgery in other jurisdictions, or even, in our jurisdiction, we refer to the orthopedic doctors because they have to define, is there bone in that finger or not? And then they take the next steps.
Do not try this at home.
Do not try this at home. This thing of tying string or putting a rubber band on it, we see it all the time. And it comes very big and blue, You may get away with it, but it can become infected, so please let us help you with this.
All right. We're discussing obstetrics and pediatrics all in one here on this edition of House Calls, talking about birth defects. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on House Calls. Go ahead, please.
Hi, good evening.
Good evening. How are you?
Good evening.
Good. I want to find out something. If her mother had multiple antibiotics during pregnancy, what effect can that have on the child? Can the child get ADHD from that?
So ADHD, attention deficit hyperactivity disorder, is not related to the use of antibiotics in pregnancy. I would say to you that we have a special manual that we use, and we do get calls from the obstetricians very frequently to say, I want to use this medication, even in breastfeeding too. Where does it fall? So when we're giving guidance, we say, okay, this medication is safe in pregnancy. This medication is of unknown risk. This medication can be used but may have a negative effect, or the effect of this medication is unknown. Right? We look at how the medication is dealt with by the body. Is it cleared by the liver? Is it cleared by the kidneys? Does it come out in the breast milk? Will it affect the baby? So we will look at the reference material based on the type of medication and give guidance as to whether or not it should be used in pregnancy. So I can't give you a blanket statement, but ADHD and the use of antibiotics in pregnancy has not been proven.
Okay. All right. Caller, thanks. Really appreciate it. Let's go back to the telephone lines. Good evening. Thank you so much for joining us on House Calls. Go ahead, please. Good evening.
Is that me?
Yes, you're on. That's you calling.
Hey, good evening. So I am a parent. Hello?
Yes, go ahead, please.
Good evening.
No, we're asking, we're asking you not to listen to your television. It's going to have a delay. Listen to the telephone, please. Either the cell phone or if you're using a landline. That's the telephone, not the television. It's going to have a delay. Go ahead, please.
So I am a parent. I am a parent of a child with Down syndrome. I was 24 years old when I got him. I am really happy that, it's the awareness is now out there. Because even when I gave birth to him, the way it was announced at the hospital, it was in 2005 at the Alberton Hospital. And the pediatrician just came in on the ward, lifted him by his hand and then dropped him. And, at that time, Alberton ward was like an open ward where all the parents are, all the other mothers are there and all of that. And he was like, this child have Down syndrome. He will never walk. He will never talk. He will never go to college. And I was really devastated with the way that announcement was made. But then, being the person I am, I basically went and do my own research and all of that, and to my, I basically canceled out what he said to me. And my child is walking, he's talking, he's doing everything that he said, he couldn't do. He may not make it to college, but, I think that the doctors need to be more careful with the way they announce these kind of things to parents. Because I was devastated, my husband was devastated, and, and it was a really, really tough time for us. And I heard Dr. Bell, you were mentioning about the checkups and the folic acid, and I went through all of that. So going through all of that at the age of 24, I had more than 8 visits because I was visiting the public clinic and I had my private doctor visits. And yet this happened. And, I stopped questioning it, but before I used to, blame myself, what could I have done possibly to cause it, or something with my husband or whatever. But I'm, more so happy at the fact that the awareness is out there. And, it was really enlightening for me yesterday when I see everybody rocking the socks, in recognition of Down Syndrome Day. I really want to thank you for the job that you're doing, and let's just continue to make this awareness, because when I had my son, there were people asking me, what is wrong with your son? And I have to ask them, what is wrong with you? But I find it's less now. I don't get that anymore. People don't ask me that. And I'm a proud mama of my Down syndrome child. I go take him everywhere, I don't hide him. And I want to reach out to other parents out there that might be hiding their children. Stop it. Your child is an individual. He's a person. He's unique, he or she, and they're different. And treat them like that. Thank you.
Caller, thank you so much. That was a powerful testimony. That was extraordinary. And by the way, we're rooting for your son to go to college. And I'm pretty sure that that will happen as well. So thank you very much for sharing your experience with us. And that's a powerful, that was a powerful message, Doc, because she was 24.
Very
so again,
powerful message.
Issue.
So it comes into what we've been saying in terms of the misconceptions. It comes to bring home the point that stigma sometimes can come within us as healthcare professionals. I want to apologize on behalf of the healthcare facility and on behalf of us as healthcare professionals for that experience. And I'm so thankful that you were willing to share so that we can all hear the impact that we can have. We cannot tell someone how to tie their laces unless we've walked a mile in their shoe. I want to bring up an important slide here, and I want us all to learn from this. I have it on the MAGE defects, chromosomal Down syndrome. I want to show this because it's so important. Are we finding that slide? I want to show you persons with Down syndrome who have made it big. So you're saying about college, your child can go to college. We need to go to this slide. We can't move on Burford without
Say it again.
slide.
Which slide is this?
MAGE defects, chromosomal. It has pictures of several persons with Down syndrome.
Okay, good. We're going to come back. We're going to bring that up very, very shortly. Now, can we just take the break?
There we are. So
okay,
your first, and I have to look at the names to get it right. The first baby there, that's Lucas Warren. He's a Gerber baby. It's the first time that Gerber is using a child with Down syndrome. Gerber babies usually have, this picture, picture with Down syndrome, Lucas Warren. The second one, second adult there, Chris Burke. He's an actor and folk singer. He has Down syndrome. Third picture, Jamie Brewer. She's an actress. Fourth picture, Pablo Pineda. He's a writer, teacher, consultant. First picture at the bottom, Sarah Gordy. She's an actress. Second picture, at the bottom, Lauren Potter. She's an actress. Third picture, Judith Scott. She's a sculptor. Last picture, Madeline Stewart. She is a model. And so Down syndrome does not mean that you cannot do what others are doing and even excel. This is just an example of what can happen. So I'm so thankful that you've shared your testimony, and please, I'm crying out to society that we need to stop the stigma now.
And again, we're underlining the message that, caller, your son will go to college, all right? So we're batting for you and your son. All right, let's go back to the telephone lines. Good evening. Thank you so much for joining us on the house calls. Go ahead, please.
Mr. Bradford?
Yes, ma'am.
I crave your indulgence to back the lady that just spoke a while ago. I know of a child, she was a baby, when this person took her. They said she didn't have any brain, she had cleft lip, and she would never learn. She goes to a secondary school now, and she goes to the Olympic, and she's going back again. So that lady, keep hope, because if this little girl can make it, and I think Dr. Bell know who I'm speaking.
Yes, I'm aware.
You know,
I'm aware.
yeah,
We have
good.
several participants in the Special Olympics.
Very well,
and they're doing very well, very well.
Thank you, caller. I really appreciate it. So, significant support for the caller there for sharing her experience. That was a powerful testament. Don't let Down syndrome get you down. In other words, you can rise like the phoenix. You can do anything you want to do. The power of the human spirit. All right, we're going to take a few more calls, Doc, but I think you had another point.
Yes, I need to make something very clear here tonight. You know, the Lots of Socks campaign, that's just the tip of the iceberg. You know, what are the next steps? And I need to mention that. One, we need to optimize the educational framework.
Yes.
We need to optimize it, build capacity in terms of our teachers, the facilities that they have. We have to integrate the support services into the public health system. It should never be that because you are not well off, that your child will not have a good outcome. That is unacceptable. We spoke about capacity building. We have to review the policies and legal framework. We have to look at the availability of funding. We have to look at having community-based rehabilitation. We have to optimize the reproductive health approach. How can we get mothers to ensure that they have antenatal care? Do we need to go out to them in terms of a community outside of the district clinics? Do we need to do something else?
Yes.
Do we need to have more PSAs available? We have to optimize our approach. Surveillance system that speaks to having a registry so we know who has what and who is where. We have to initiate support groups. So next year, that is our plan. Support groups are important because persons who are going through similar things can hold each other's hand and lift each other up. And so support groups is one of our next steps, and educational campaigns.
Excellent, excellent. So in other words, it's great that everybody would have
rocked their stocks.
Absolutely.
Awesome. Awesome sauce.
Let's take it further. So in other words, let it not rest there. Let's take it further to ensure that we continue with the practical support in targeted areas to ensure that that support continues. Of course, we here at ABS will do as much as we can. I mean, this is a part of getting that message across. We're going to take it two more calls, 4622996, 4622996 before we wrap up. We'll also take all the questions on Facebook, gentlemen. Okay, so we'll take two more calls, 4622996, as we wrap up. The message that you want to get to society, to women who are either pregnant or planning to become pregnant, crucial messages.
Crucial messages. Plan ahead. The pact. Plan ahead. Avoid harmful substances. You know, have healthy choices and speak with your healthcare provider or talk with your healthcare provider. It's very important. If you have chronic illnesses, you need to have those illnesses under control. If you have an increased weight, you need to get to your appropriate weight for height before you consider getting pregnant.
BMI, body mass index.
Body mass index. Right. Antenatal care is important. You need to have at least 8 visits in an uncomplicated pregnancy. Folic acid is important. You need to start at least 1 to 3 months before pregnancy. The other message I want to get out there is that everybody who has a birth defect does not have Down syndrome. We tend to lump everybody into almost this bucket list or on an umbrella term. I have a child who is not able to speak, or have a child who has intellectual impairment. It's Down syndrome him have, you know what I mean? Everybody does not have, you have autism, you have Down syndrome, you have a child who has dyslexia, you may have a child who has a club foot, you know what I mean? Or even something like cerebral palsy, but they're firing on all cylinders.
Absolutely.
So what we're saying is that remove the stigma and try to support as best as you can. Okay?
Excellent.
That's I think, the take-home message.
Let's go to our penultimate caller this evening. Good evening. Thank you so much for joining us on House Calls. Go ahead, please.
Good evening. I tuned in a little late, so I'm not sure if the subject of dwarfism was covered. What are the causes of dwarfism? And somebody that is born with this type of defect, would the doctor recommend a particular surgery? I saw it's called limb lengthening. We can well, I guess that's self. Would you recommend that? I don't know if dwarfism was covered. I'm not sure, but could you just elaborate on that for me, please?
So in the initial part of the program, I spoke to many ways of classifying birth defects. And one of the more fancier ways which you spoke to was the whole issue of dysplasia, right? So you can have what is called skeletal dysplasias. So there are many different types. So it would be difficult to answer your question in terms of surgical intervention, in terms of limb lengthening, because you have many different types. And we have to remember, you have to look at the length, not only of the legs, but the length also of the upper limbs or the hands. So that's a very technical question, and it would have to be on a case-by-case basis. But yes, dwarfism would fall on the whole issue of birth defects. The skeletal dysplasias would fall on the word dysplasia itself. And there are many types which will have to be taken on a case-by-case basis. So I can't give you an overall or resounding yes in terms of limb lengthening procedures.
All right, caller, thank you so much for the call as well. Let's go to our final caller for the evening. Thank you so much for joining us on House Calls. Go ahead, please.
Hi, good evening, Dr.
Good evening.
Good evening.
And good evening to your panelists.
Indeed, good evening to you.
Very interesting program. I have a question. What about the ladies that are doing hairdressing, the hairdressers? I observe some of them are having a lot of issues in getting pregnant. Would you say that it's because of the chemical? And some of them, when they do get pregnant, the child is not normal. What would you say that caused that?
Really appreciate it.
Thank you so
Yes,
much.
thanks.
So remember, we had that nice little diagram that showed the fact that the risk factors are many.
Yes.
It's multifactorial, so it would be really difficult to say, that this particular use of a chemical will result in a baby being abnormal. We did speak to the impact of environment and the fact that, strong chemicals, lead, different things in the environment can contribute to birth defects. What I do notice is even in the nail salons, the scent is very strong and pungent as well, so you have to be very cautious. But again, it's a holistic approach because we don't know what that person's genetic potential is. We don't know, if they smoke, if they drink, other factors that can contribute to birth defects. But your point that is made is valid in that we have to be cautious of the environment in which we find ourselves when we as women are pregnant.
Do any studies suggest a sort of causative link between these chemicals and
Not
birth
that I'm
defects?
aware of, but I have not reviewed that aspect recently, so I don't want to misspeak.
Fair enough, fair enough. And thanks, caller. Really appreciate that. It's a good point to look further into, certainly going forward. Doc, it has been what an enlightening experience. What a perspicacious experience this has been for our audience. We thank you so much. I mean, you've outdone yourself. I mean, to cover so much in such a short period of time is extraordinary. And the takeaways that you have given to our audience about ensuring that no stigma, continue to be vigilant and to plan ahead for pregnancies, that was powerful. And we hope that our audience would have assimilated it and will ruminate on it and cogitate on it and to make informed decisions. Because that's what this program is about, ensuring that you can get the information and to really help you to make informed decisions. I know you want to have a few last
Mr.
words.
Burford, two things. I need to have an appeal to places of employment.
Indeed.
We have to consider those who have special needs, and they need to be employed. They need to be employed, so we need to look back at a bit of the labor code and what the office space is doing. If you want us to come in and speak with the persons, within the workplace, we're willing to do that. That's one thing. Secondly, I want to make the point that children with Down syndrome, autism, attention deficit hyperactivity disorder, heart disease, seizures will become adults one day. What better time to make a difference than now when they are young. We have to prepare them, educate them, prepare them for the workplace, and protect them because there are predators out there who will take advantage of our children who have intellectual impairment or other defects. And then the last appeal, rather PSA, the month of April, autism awareness. Join us. We're going to have something very significant. We're going to be wearing blue on Fridays. We're going to light it up blue in terms of physically lighting up blue, not only in what we wear, but also in terms of lighting it up blue in the buildings. We're going to have some artistic display. And so look out for, if you thought Down syndrome awareness was the bomb,
yes, yes,
then look out for autism awareness. And again, raising awareness, we can have fun raising awareness, but it's just tip of the iceberg. We have a lot more to do here in Antigua and Barbuda, but we want to ensure that no one is left behind, that we're all moving forward in the same direction.
We hope the policymakers have been paying attention to this program. Yes. The legislators, policymakers, opinion makers, and opinion shapers, that they also bear this in mind, that they have a part to play in this. Doc, a tour de force performance from you. Really appreciate it. Brilliant. And our audiences appreciated it to the hilt. Next week, a sneak peek of what you can expect. Look out, because this will be our next doctor in the house. Dr. George Mansour will be up next on House Calls to discuss hypertension and diabetes. Look out for next week's program. It'll be just as impactful and epic. Really appreciate your company. Until then, until next week, really appreciate, look out and make sure that you join us. Let's thank our executive producer, Erna May Brathwaite, our production assistant, Mary Charles, the team in the control room, Lennox Phoenix, and others, Etal. Thank you so much for joining us. See you next week. I'm Garfield Burford. We thank our sponsors, Sagicor, as well as our partners, Pink Mongoose and A.G. Morgan. Goodbye for now.